Hi, this is Dominique Well from Well Medical Arts, and we are going to be doing a demonstration of a testosterone pelleting today. We do this for male andropause or hypogonadism, erectile dysfunction, or just men who feel like their energy is low, they have passed their peak, they have insomnia, fatigue, decreased morning erections, they feel like they're shrinking, confidence is going down, a lot of symptoms that the testosterone replacement will help treat. So we're going to go in and just do a demonstration of how easy the testosterone pelleting is. People can start to feel the effects of them as soon as a couple of days to a week, but they really hit their peak at about 6 weeks, and that's when we draw people's labs to recheck their lab values. We do the pellets, the bioidentical hormone replacement therapy, and in the form of pellets for women as well as for men. Same thing where we've got menopausal symptoms where women are having hot flashes, night sweats, headaches, irritability, insomnia, mental fogginess, weight gain, decreased libido, and we go in and we test their hormones, determine which hormones they need. The pellets are nice for the testosterone because it gives a nice, even, steady state. For the testosterone replacement in women, women can expect to see a decrease in the mental fogginess. They feel a little sharper. The insomnia is improved. They're sleeping much better. Energetically, they feel good. It tends to be great for helping maintain weight and build muscle mass for everyone. And then libido is increased. Testosterone, both for men and women, dosages is very different. Gives a great improvement for quality of life. Okay, we are going to be pelleting. This is a male pellet insertion. These are testosterone pellets. First I'm going in and of course cleaning the area. He does not have a lot of fat. We are trying to set as sterile a field as possible. And then I'm going to go in and just gently lidocaine the area. Really does not hurt. Little tiny 1, 2, boop, tiny poke. So we use just a little 30 gauge. 30 gauge isn't attached tight enough. There we go. Sorry, one more time. 30 gauge to just put the very first little bit in to numb it up. The old numb it up before you numb it up. And I actually have, this is Lido with epi and a little bit of bicarb so it doesn't sting. So now it'll be numbed up when I go in. And he really doesn't feel much. Just progressively Lido the area. And Lido the area that I will be injecting. Almost. There we go. Looks great. And just let that set a little second. Make this small. Very easy. Now, placing the trocar, using the end that's going to be making my trail. First start with men tend to be a bit more fibrous than women, so it does take just a bit of manipulating. There we go. And then pull out. And carefully place the pellets into the trough. So these are 200, so I'm going to go 2, 4, 6, 8, 10, and then we pack those down in there. Trying to keep the trocar in place. There we go. And then pull out. And then I'm going to make my next one. And I can feel those ones. Those ones actually might be a little bit superficial. This next one, just under the surface, just kind of the bulk, the thickness of where they are. This next one, I'll make sure it goes a little deeper. And you can also do it if you want to make more fans, more troughs, like 2, 4, 6. You could just put 601. Depends on how many you want to make. There we go. So that looks in there nicely, nice and deep. And this one, so I've got 2, 4, 6, 8, 10. I've got 5, so 1,000 milligrams, so 5 more pellets. I'll do it where this one, I put 3. Same thing, hold it in position, tap it down nicely. There we go. That one I felt insert just perfect. And those ones are down in there great. How are you doing? Are you feeling anything?
Just pressure, slight bit of pain at the one.
Okay. So maybe he could have used a little bit more lido. I used 11 mLs. Almost there. There we go. This one?
Yeah.
Good. Yeah, probably just depends on how much it really is lidocained. Almost there. I want to make sure that's nice and, there we go, positioned perfectly. Great. Last one. Great. Feels good. I could feel it pack and stay down there. You can feel a lot of it as you're doing. You can feel if it's going right into the position where you want to. These ones I think they're more right here, as where the other ones are actually further down a little bit more into the fat. And if they do, I mean, I can't physically feel them, but if they're placed a little too superficial, the patient sometimes can. It's not ideal. You want it really into that subcutaneous tissue. Okay, so he made it perfect. Good job. Now, 0 to 10, how was that for you? Mild discomfort. Okay. And it should be a 0. So my technique can be improved, right? Always get better and better. And it just tells me that he could use a little bit more lidocaine in the future. Good point. I also could have let that lido sit a little longer. So just place in this few steri strips. And then a 2x2. And this is just as a little bit of a pressure dressing. Lift this up. Great, nice little sealant. And then we say no submerging in water for 24 hours. It's got that nice little protective bandage. And then we will recheck labs in 6 weeks. Fantastic, great job.